Good evening and welcome to Health Plus Weekly. I am Maureen Boyle, the Public Information Officer for Southcoast Health. Thank you so much for tuning in. Tonight we're going to begin a three-part series on Southcoast Health Weight Loss Center. We're going to be exploring psychology, nutrition, medical interventions, and much more over the next few weeks. To start off our series, we are here with Suzanne Gokavi, behavioral health practitioner and licensed independent clinical social worker. Suzanne, welcome to the program.
Thank you very much. Thank you for having me. And thank you to all the bariatric patients and weight loss surgery patients and weight loss management patients who are watching tonight. Please participate.
We also have Sean Badgley, who is my wonderful co-host and our wonderful social media coordinator at Southcoast Health. Sean, say hello.
Hello, everyone. Thanks for tuning in tonight, and thank you, Suzanne, for joining us.
Thank you.
You guys will find out very soon that Suzanne is an authority on this subject, and she's also incredibly sensitive, and her experience is second to none. So we are live tonight. We are accepting your questions. Please ask Suzanne anything you'd like about the Southcoast weight loss program and other issues, and we will make sure that she is able to answer those questions. So thank you very much.
Excellent. Thank you, Sean, and thank you, Suzanne.
Thank you.
So, Suzanne, tell us a little bit about yourself.
So I have been working in the field of mental health for just about 30 years and have had a private practice for nearly that long. But for the last 15 years, I have been in the bariatric surgery program with Southcoast Hospital. The first 10 years, there were three of us that worked in the private practice setting, and we sort of coordinated with the hospital program to provide certain services. And then in 2014, we were brought in-house and became part of the entire program integrated within it. So in the last 3 to 4 years, I've been working full-time in the bariatric surgery program and weight management as a behavioral health practitioner.
Wonderful. So it's a very, very comprehensive program. Can you kind of give me a scope of what the program's like and sort of where you come in that process?
So there are probably, 20 to 23 people or so on our core team. Typically what happens is a patient, this would be a bariatric surgery patient track, come in the door after seeing a seminar, which was typically run by one of the surgeons. They will then come in and see a surgeon for a visit, and then following that, they're given a brochure, a booklet that we've put together to help them track their way through the program, which is roughly 4 months or so. They start with nutrition typically, then come to us. So I'm typically the third appointment that the patient sees. They have 2 appointments with me. There's a couple of dietitian visits. There's some medical and lab work and all of that kind of thing to be done, medical clearance visits. So I'm sort of in the beginning of the program, and then towards the end, the other role that I play is that myself and my 2 colleagues, teach lifestyle education workshops in small groups, and those are mandatory, required parts of the program. At the back end of the program, I am the support group leader for a couple of the towns, and Maria and Rachel do the others. And we also have even another program that's for even beyond post surgery experience.
Great. So it's pretty much all under one roof. Can you tell me a little bit about why mental health is so integral to the success of somebody's journey in this process?
Right. So the mental health piece of weight loss surgery has been established by other programs before we began ours. In fact, we mirrored our program on some other programs that had integrated mental health within it. Bariatric surgery is a physical and surgical and metabolic intervention, but it works best when it's coupled with all the other disciplines. And so for mental health, besides being required for part of the insurance process, making changes is very much a, between the ears type of thing.
Right.
You can have surgery, you can go on a diet, but unless you address or understand certain other issues, you're missing a piece of the puzzle. And if you're missing the piece of the puzzle over many years, that is often where things sort of slide downhill and people get discouraged and end up, regaining, say, after a diet or whatever. There's just more to it than people think.
So where it's, a pivotal, a really important piece of the program, would you say that therapy in general, for anybody going through this process, would be advised, whether it's before or after or continuing along the journey?
I don't have statistics specifically, but as I interview patients all week long for 15 years, I find that many people are already in therapy. Mm-hmm. And that might be because they struggle with a mental health issue, depression, anxiety, something else. It may be that they've gone for therapy for something else. Some people have gone to therapy for their food-related behaviors and trying to make changes to their lifestyle. We often suggest that people consider it in the process of it and may benefit from even doing it prior to their surgery. And certainly it often comes up in the support groups, and we refer people out to therapy frequently, even if it's just for a brief few months to learn how to partner with somebody to increase their coping skills, for example.
Great. So what are the most common psychological obstacles patients suffer with when seeking this type of treatment? I'm sure people come in with all kinds of stories, all kinds of histories coping with this essentially disorder. Can you tell me what kind of common psychological obstacles you see frequently in your patients?
Things that would be truly sort of psychological mental health issues and mental health disorders would be the common ones that we see in the United States and all around the world would be depression and anxiety. Those things are very common. There are lots of people that have trauma histories. There are people that have abuse histories. There are people that have a background of substance abuse disorders that are now in remission. So there's a lot of different things that are sort of psychological issues. And then there are just lifestyle issues within the family, community, social issues, communication issues, within the family. So there's a lot of things that we are trying to assess in the evaluation. It's really a psychosocial evaluation because we're asking folks about all of those things that I just mentioned. We also want to know about their support system and their living situation and their occupational situation and their financial situation and the amount of support that they have now and the amount of support that they'll anticipate having, and do they have help with their children if there's young children in the home, and all kinds of things.
And I would imagine stress, you'd mentioned children. One thing that comes to my mind is, busy moms who, have a lot going on. They're juggling work, organizing childcare, and I would imagine that stress plays a big part in why some people might choose food as a coping mechanism.
Very true, very true. We all have to eat, so we all have food as the issue of a coping mechanism. I would say that most of us, regardless of our weight, often cope with things with food. Stress is also something that is never going to go away in any of our lives, but it is a matter of how do we do it? How do we manage it? Right. There are healthier ways to deal with stress, and there are less healthy ways to deal with stress. And most of us do some of both. When you seek weight loss surgery or attempt to really manage your weight for the long term, you really need to learn how to manage your stress in the healthiest ways possible.
Right. So one thing you mentioned a little bit earlier was you mentioned a relationship with food, and we kind of talked about stress and coping mechanisms. And I know in my case, I certainly can't live without dark chocolate when I'm stressed out. So I want to just unpack this idea about the relationship of food. So where does that come from? Where does that relationship with food come from? Is it learned? Is it, let's sort of unpack that. So can you explain to me what you mean by relationship with food?
Yeah, and this is a question that I always ask patients. What do they feel that their relationship with food is? Mm-hmm. And for some people that requires more of an explanation than that, and other people jump right on that question and know exactly what I mean, or they have a ready answer. We all have a relationship with food. With a few exceptions, most of us really love it, and it means something to us, and especially means something to us if it's special foods, comfort foods. And where did we learn to eat? We learned to eat in the families we grew up in. So what we were given for food, what the special occasion foods are, what our ethnic and religious backgrounds are, and the food is an integral part of our society. We learn it from childhood, from infancy, from the day we're born. Food is received as love from the very beginning in our lives. So to say and to assume that we don't have a very close relationship with food is usually short-sighted, and people just may not have thought that much about it before. They say, well, I like it, I eat it because I like it. And that's true, we do that, but we also have a relationship with it. And as I said at the beginning, some people will say, I think I'm addicted to it. Other people will say, I don't really think I eat enough. I don't eat often. I skip meals. I skip, I go all day and I don't eat. So I don't know if I have a food issue. So I think that it's a topic that we discuss within the evaluation sessions.
Right. So that's an interesting point too, because essentially obesity is a metabolic disorder, and the timing of when you eat and how you eat can be a huge part of it. So some people, when they're stressed out, maybe they skip meals or they don't eat. Can you just tell me how the timing of food and how you eat it and when you eat it and whether you eat it fast or slow and when you're being emotional? Let's talk a little bit about that.
Right. Well, to put it in the framework of what do we try to teach within the bariatric program is that we want people to eat 3 meals a day. A snack if they need it, or 2. If they don't have to have it. But not neglecting yourself by not eating is something that's very important. We can overdo with food, and sometimes we just kind of neglect ourselves because we forget that our body is an engine and food is our gasoline. It's how we fuel our cells, and it's very important for us to nourish our bodies. And sometimes that can get very skewed. And in the lives that we all live today, and we work all hours, and we don't always have lunch times that are, half an hour at work. That doesn't happen for everybody. And so we get into lots of sort of maladaptive eating patterns.
Right.
And I think that's something that we always have to talk about. We're aiming for patients to have a more regular nourishing their body. Certainly after surgery, they need to do that on a regular basis forever and not fall back into those old patterns. It brings up, too, the whole issue of taking care of yourself. Right. And this is tied into stress and our relationship with food. Sometimes people feel that they're taking care of themselves. The only way they're doing that many days of the week is with what they're eating. They're running from one thing to the next with their kids, with their job, with their parents, with just all the things that we're all doing all the time. And that food is one way that they give themselves something that is soothing, that is comforting, that is just for them. This is not everybody. This is not a universal thing, but it certainly is pretty common. So.
Right. One instance that comes to my mind is, it's not just you had a bad day. Here's Mom baked some cookies, but also you did great on your tests. You deserve,
right?
A cupcake.
Yes.
Which that's what I did.
Many of us, we can all, right? We can all reach back into our childhoods, and
right.
Yes, some of us, might have gotten a new toy, but it could have just as easily been, let's bake brownies and let's go out for ice cream and let's have pizza for supper. And we are really taught that food is a good go-to for fulfilling certain emotional states.
Right. I was going to say, for some people, did it take the place of learning emotional communication skills?
For some people it will, yeah. Not for everybody, but certainly there is some literature about trauma. For people who have had trauma and have eating disorders. In certain people, they will use food to numb themselves in order to not feel distressing feelings because they don't know how to deal with those very effectively. And so one of the ways of dealing with them is to not deal with them, and eating is a way that helps cope with that. People who have ever had a substance abuse disorder may recognize that same sort of behavior of sort of, you're trying not to feel.
Right.
And so for some people that becomes the case.
All right. So one thing that comes to mind when you were mentioning trauma, that there are all types of trauma. Can you speak to that a little bit?
So there's traumas that people that would experience in their childhood, right? It could be sexual abuse, physical abuse, emotional abuse, neglect, people that have grown up in sort of a scarcity of what they needed. There are certainly traumas that happen later on in our lives, things that happen to us as adults, deaths in our families and deaths of partners or children or other kinds of traumatic events that, become the trauma. Right. And depending on what was going on in that person's life when that happened, and whether or not they had sort of already the good coping skills to deal with it, mm-hmm. If they did, they may have been able to do that. If they weren't in a good place when something traumatic happens, we do what we know how to do. We certainly as children, we do what we need to do to survive.
Great.
Right.
So how's our Facebook feed going there, Sean?
Our Facebook feed is going really well. Thank you, everyone, once again, for taking part. And I do want to start with a softball question from Tom in Marion. He says, and I'm not sure if Tom is a Southcoast employee, but he might be, because he says, this program has an excellent reputation. My question, why is the Southcoast Bariatric program so successful?
I think it really is because of this integrated program that we have. First of all, we have really dedicated people who work in every level of this program. Many of us, myself included, have been with it from the beginning, but even people that have joined along the way, I think if you're doing this work, you feel passionately about this. We adhere to strict standards. We are, of course, a center of excellence and have been for a number of years. And I think between the personnel, the dedication, and the standards that we all hold ourselves to, I think that's one of the reasons. We are always looking to improve. Every department is looking to improve. We're always, so I think any program worth its salt is doing that, right?
Definitely.
Yeah.
Excellent. Thank you, Suzanne, and thank you, Tom. Another question from Anna. She says, I had open hernia surgery and have a mesh. Is weight loss surgery possible? Now, this might not be a question in Suzanne's area of expertise, but Anna, we can certainly direct you to the appropriate resources and make sure that we get you a helpful answer to that question. So, and Suzanne, did you want to talk about that at all?
No, I'll just say that certainly needs to start with a surgeon first.
Absolutely.
Yeah.
Thank you, Anna. And here's a comment from Tanya. She says, Suzanne is amazing. I had my surgery last Wednesday and I'm down 12 pounds at 1 week. Check up today. It's a great team. So thank you and congrats, Tanya.
Good job. You're working hard.
Thanks, everyone.
All right. Well, not to go back on a somber note, but I just want to explore trauma just a little bit more before we take a quick break. Bullying seems to be a big issue in our society, and for some people who may have been struggling with obesity for a lot of their life, when you have patients that present themselves with a history of bullying, how does the program approach that, and what is the advice given through the program?
Bullying comes up again in the evaluation and is something that we talk about. I think many people would agree that there is a lot of discrimination against people due to weight, and people do not understand the concept of obesity as a disease. So certainly people were bullied, perhaps as children, if they were people who have struggled with obesity since their early life. Mm-hmm. But certainly there is also bullying in the forms of sort of discrimination that can happen in the world of adults, of course, right? Mm-hmm. In the workplace and even in healthcare. But to go back to your question more about bullying, I think that is one of those things that some people will have dealt with that better than others, right? Some people will have dealt with childhood bullying by fighting back, which is probably might have been in their best interest in the long run. Some people, verbally standing up for themselves. Some people might have really taken that inward, and it has affected very deeply their sense of self, their self-esteem, and their self-image. And that is one of the things that many, not all, but many people will have to struggle with as they go through the bariatric surgery, as they lose weight, as they change, how they feel on the inside. Accepting compliments is an example of that. If you've been bullied as a child, and now here you are, X number of decades later, and you have reclaimed your life and you're really trying to make these positive improvements, it can be a very awkward, could be fun, could be uncomfortable to accept compliments and to know what to do with those if you don't have much of a history of being able to do that. And in fact, what I have seen personally is that a lot of people who were bullied and have this self-esteem issue, they are most critical of themselves. Nobody else could really probably be as critical of them as they are of themselves. And that is some of the work, too, that has to happen as they make this transformation.
Right. And maybe it should be said that when people seek, bariatric surgery, it's to answer, a medical issue. Could you speak to that a little bit?
Yeah, I think people come to surgery for a number of reasons, but almost always the number one driving force is to improve their health. Mm-hmm. So either to improve medical conditions that they have, or in some cases it's to prevent it because they have this family history and they're just sort of waiting for things to go wrong. So I think that is very much what bariatric surgery is about, and those are the typical initial presenting factors, and they are certainly the top of the list of what people hope to achieve. But there are also other issues that people are hoping to achieve, and when we sometimes talk about this in the workshop classes, people always bring up, they hope that their self-esteem, they think that their self-esteem and their sense of confidence will change, their ability to dress differently, their ability to maybe change something about their working situation, their social situation, right, doing the things that they haven't done for years. So there's lots of psychosocial factors that also are behind the push to do this.
Right.
Yeah.
If I could jump in just for
Absolutely.
a second, we've got a great question from our Facebook feed, and Suzanne, you mentioned the support group briefly, and along the lines of the bullying discussion and self-esteem issues, we have a question from Joanne who asks, how important are the support groups and follow-up visits in the years after the program?
So support groups are huge, and those of you who are patients of ours, you know this, especially if you come to the support groups. Every year, most of the team goes to the American Society for Metabolic and Bariatric Surgery, ASMBS, and that's where we usually get sort of the latest research. And almost every year, there's a topic or a paper or a poster on research on support groups. And every time I've ever heard it, it's always the same thing, which is support groups have a great likelihood of making patients more successful. And something that I read within the last 2 weeks as I was preparing to talk about this said that up to support group patients who come regularly may lose an extra 12% of their weight beyond people that don't. It's one of the amazing things that we offer at the program. They are free to you as a patient to come for the rest of your life if you wish.
Wow,
and we have
great.
Patients who do come who are 12 years out, and we've been doing this for 15, and 7 years out, and 10 years since their surgery. And it's key because people get to communicate and talk with a group of people who, although they may be different in many ways, have such many things that are so similar, and understand the journey in a way that even the most supportive spouse or friend or sibling is, though they may not have had surgery, and
Right.
then it's really important to sit in a room of people that really get it.
So it really
And
takes
learn from each other.
a culture and a community around it
Absolutely.
too.
Absolutely. This
have-
is a lifelong journey. This
Yeah.
does not happen in a year. When you've lost the weight, which is the rapid weight loss phase, is roughly a year, maybe a little more or a little less. The transformation that needs to go on probably takes at least 5 years to transform the way you think, your habits, your behaviors, your normal responses to things. You know, if you're 40 years old, you've had certain behaviors and patterns that have gone on for decades, perhaps.
Right.
You don't change those in a year. Just because your outside changes and you lose a lot of weight doesn't mean that the inside has caught up to you at all.
Right.
And in
Right.
fact, that is usually the way it is. Very few people feel that they are even close to completing their internal transformation in a year. And many people don't even understand their external transformation in a year, especially for folks who have struggled with obesity since their teens or childhood. They have no picture of themselves physically as an adult person that's not obese. And so when they lose weight, although the scale and the size of their clothes would say they're not obese anymore, in their minds they are, oftentimes, and sometimes for years for that to really sort of work its way through. And that doesn't just happen naturally, that's the work that they're doing
We have
to make it happen.
Sorry to interrupt,
Sure.
but we have a testimonial to that. Robin has commented that 10 years ago she had the surgery. She's lost 130 pounds, no gain since then, and talks about what a great program it is. And that's 10 years.
Yes.
So that gives you an idea that it is certainly a journey.
It is. It is. It's a lifelong journey, and somebody who really is probably an expert like that person, Robin, when you've had this surgery and you've kept off your weight for this long, you understand that you've probably lost the weight. Maybe Robin had a little period of time, I don't know if she did, but it's not uncommon to have a little period of time where you regain some weight. You might even fall off and regain a little more than you want, and then you figure it out, and you get your feet underneath you and you learn. And so by the time you're 5 or 10 years out, a lot of learning has taken place, and you are much more confident in your ability to do this forever. But most bariatric patients will tell you this is a journey that will never, ever end, that they will have to battle their weight and think about how to manage their health and their weight for the rest of their lives. There's never going to be a point where a successful bariatric patient says, I'm done, I'm all set, I can just, I don't have to think about this at all anymore.
Right.
It isn't that way.
Excellent.
Yeah.
Great. Awesome. Thank you. So we're going to take a quick little break, but first, Sean is going to engage our audience with a myth versus reality. What that basically is a question we're going to pitch to our audience to see if they know the answer. And when we come back from our short break, we will have Suzanne weigh in.
Excellent. That's right, folks. We have a true or false question for you. We'd love if you take a crack at it in the comments. Where food can be considered a coping mechanism for many, it is in no way an actual addiction. Food cannot chemically alter the brain in the same way drugs or alcohol can. Again, that's a true or false question. Where food can be considered a coping mechanism for many, it is in no way an actual addiction. Food cannot chemically alter the brain in the same way drugs or alcohol can. True or false in the comments, and thanks for joining us tonight.
I was motivated to seek surgery because both of my parents were raging diabetics. I didn't want that to happen to me, and I could see it coming. It was coming. I was getting older, and it took a couple of years of talking from my primary care physician, who kept suggesting weight loss surgery, and I kept saying, no, I can try Weight Watchers again. I can try Atkins again. Let me try this again. Let me try this. And nothing ever worked.
My life before my procedure was going down the hill. I was very bad diabetic, taking insulin twice a day with pills. My blood pressure was out of control. I couldn't walk 20 feet. I had bad sleep apnea. I was a couch potato. I didn't want to do anything. I really was having a hard time with life, period. Well, I started, my high weight was 375. And now I fluctuate anywhere from 192 to 200.
I started the weight loss program here at Southcoast in 2004. In 2004, the technology for weight loss surgery was changing from open procedures to minimally invasive laparoscopic procedures, dramatically changing the safety and recovery time for those procedures.
The breaking point for me to make the decision was actually talking to my doctor. I was having problems. I was, my breathing and a couple of things, my sugar and everything, my blood pressure. And they just said, you can't keep going like this. You're 62 years old. You just can't keep up this pace health-wise. You got to start doing stuff. And it just hit like somebody hit you with a sledgehammer. Now's the time to do what you have to do.
One of the advantages of the Southcoast weight loss surgery program is its commitment to long-term support. Again, our team of dietitians and behavior specialists do run multiple support groups monthly throughout the region to make it convenient for patients to stay in touch with the weight loss surgery program.
The support system is amazing. There's a support group every month, and you meet people doing the same thing you are. So in your regular life, as you're going along, the people who are always with you, maybe you don't want to go for a walk at 5 a.m. Ask somebody in a weight loss surgery support group. They're all looking for somebody to do stuff with. Everybody's journey is separate, but the paths are kind of parallel.
We educate our patients that the surgery is a tool that will allow you to lose significant weight over a short period of time of a year, but the lifestyle commitment and long-term support is necessary for long-term success.
I do a lot of things that I haven't done before. I do walk, I go to the gym. I'm faithfully at the gym all the time. But just stuff around the house. I cut the grass more now, where my wife was doing it. I work around the yard. I feel good. I have no stops.
Over the last 10 years, the transformation of weight loss surgery to being done minimally invasively or laparoscopically, much like gallbladder surgery now, has made the surgery now have risk along the lines of very common procedures such as hernia surgery and gallbladder surgery.
People suggest it, and you think that your life is going to be over. I'm going to have this surgery. I'm never going to be able to eat. I'm never going to be able to do anything. And that's really not the case at all.
It's just the general health problems have disappeared. My heart doctor was amazed when I walked in. I'm like totally different. Blood pressure medicine's gone. He says, this isn't the same person. They laugh about it, I've changed my body so much. I have no problem telling people I had the surgery. I really don't, because I feel like $1 million. It changed my life.
Well, the successes for the Southcoast weight loss program have far surpassed anything we could have imagined. I think success number one is our patient satisfaction of having the services available locally, having a very well-respected, educated team caring for them, and having excellent outcomes, some of the best in the country.
I feel great. I'm active. I walk. I actually became a Zumba instructor. And it's like night and day. I don't watch hardly... If I watch an hour of TV a week now, that's it. It's always go.
So we left you with a question, a true or false question involving the myths and realities of weight loss. And the question was, where food, I guess it's not a question, it's a true or false, but it's a statement. Where food can be considered a coping mechanism for many, it is in no way an actual addiction. Food cannot chemically alter the brain in the same way drugs or alcohol can. True or false? And in the comments, we've gotten a lot of responses. Almost exclusively, the response is false. And so, Suzanne, are these commenters correct?
Right.
Is that false?
Right. I guess in some ways it depends on who you ask, because I think the answer is probably that it is true and it is false.
Interesting.
Food in general may not be able to be considered addiction in quite the same way that drugs or alcohol can, in the sense that you may not be able to be intoxicated or have life-threatening experiences because of it. I do think that many, many bariatric patients identify themselves as having had an addiction to food. And generally, it's not all foods, it's sugar or carbohydrates. And there are a number of studies, there's a lot of research actually out there on sugar and the brain. And they will look at things like PET scans, and they will, which lights your brain up in various colors as they're shown pictures within the scanner. And there's research to show that somebody that has a sugar or carbohydrate addiction's brain, the pleasure centers of their brain, light up in exactly the same way as somebody who uses drugs does when they get certain images that remind them of their drug use. So, and I think if you were to ask people in the 12-step community, you would certainly get a resounding, that certain foods can be altering to the brain the same way as drugs and alcohol is. That is Overeaters Anonymous and Food Addicts Anonymous and other 12-step programs certainly believe that, and I think a number of our bariatric patients do. So it's a little bit of a trick question. I think it's true and false, depending on in what aspect you're talking about.
Right.
Yeah.
So with the theme of addiction moving forward, so what is happening chemically in the brain? Does it kind of mirror the oxytocin release of somebody maybe using drugs?
Right. Well, without getting too much into the scientific parts of the brain, people in general know that there are pleasure centers in our brain. And in the part of the brain, in the frontal cortex, where there are pleasure centers that are stimulated by anything that is pleasurable, gives us a neurochemical reaction. We release neurotransmitters like dopamine and serotonin, and those are chemicals that flood into the body and give us a sense of, I feel good, I feel calm, I feel, it's a happy, pleasant experience. And there are many ways to, push this pleasure button. And we can do this, we do this when we're doing anything that we love, right? If we love to run and we're out on a run, we get pleasure from that. Not just we feel good, but we feel good because there's been a change in the brain chemistry, and there's been a release of these pleasure chemicals. So this can happen with food. It certainly happens, if you're a smoker and you smoke a cigarette, you get that. You would say, this makes you feel good. You may not know it's not good for you, but it makes you feel good. And so there are all kinds of things that do that, right? It feels good to hug somebody you love, and so certainly food can be one of those things that triggers pleasure in the brain.
Right. And actually, in a couple of weeks when we have Dr. Inwood on the 24th, she's actually going to address how certain medicines used also in addiction to treat.
Absolutely.
Because it's a similar area of the brain.
Absolutely.
So make sure you tune in for that, because it'll be super interesting.
I have a great question from Krista, if I could jump in.
Absolutely.
Krista in Metabolic says, do you see a lot of spouses and family members coming in for a consult for themselves after seeing their loved ones' positive results with the program?
Absolutely.
Great question.
It is, I think, the number one way that people find their way to our program is word of mouth. So it's often somebody, it's in your family, it's somebody you work with, it's your spouse. We have, I wish I had these statistics, but I'm going to just estimate that we probably have between 100 and 200 married couples who have done this.
Wow.
We have entire families where there's parents, children, nieces, aunts, cousins, grandparents, numerous people within the same family system that have had it. And I think there's nothing beating watching somebody go through this transformation and see how it changes their health and their physical status and their emotional status, to make somebody think, wow, I've been thinking about that. That was the last push they needed to go and say, okay, I'm ready. I'm ready to do this as well.
And it speaks to, building that community,
It does.
too.
It does. Yes.
Do you have another one there, Sean?
I don't have a question, but I do have a comment from Linda. She says, this surgery saved my life physically and emotionally.
Yeah. So if you were going to ask me why I've been doing this for so long, one of the reasons is, I'm a clinical social worker. I went to school to help people. To work in a program that is so dramatically, in so many ways, helping people is extremely gratifying. Sometimes in some areas of mental health, we know that change comes slowly and steadily, and there's a lot of dramatic change that comes with this. And to hear somebody, what she is saying is something that we literally hear in our offices if not every day, certainly every week. It's very reinforcing, I think, for those of us who do the work, to know that the changes that we've been able to help people make, and of course they are making it, we're a part of the process, is very gratifying. So, yeah.
That is actually a really good segue into our next area as far as the counseling aspect goes. So change is a big thing for a lot of people, and a lot of people have, carried this with them for a long time, and whatever the reasons are for that. How is change addressed and the fear of change addressed in the program?
So from the time that the patient walks in the door, all of us are sort of giving the message that there's a number of things that are going to need to change, and they need to change before surgery. In our program, and I'm sure in many programs around the country, we don't expect, surgery doesn't make you make the changes. You have to make the changes. I will say that probably people who actually show up and are ready to move through this process have already faced a number of fears, because there's a lot of people, the amount of people that could actually have this surgery versus the people who show up at our doors ready to kind of move into the process. There are so many people who have not come yet or are afraid to come yet. So I do think a lot of people have addressed some of their fears in the process of even just they're already there. They're ready to kind of move forward. But change is sort of expected, and it's inherent in the whole process. And it's change in almost every area. It's changing their lifestyle habits. The lifestyle habits that are healthy lifestyle habits that we talk about in the workshop classes. And these are actually the healthy lifestyle habits for anybody, is to not smoke. So if you're a smoker, you have to quit in order to have this surgery. So if you're a smoker out there and you want to have the surgery, quit before you come in the door, because you will have to quit. We want people to be exercising, because that, again, is part of a healthy lifestyle, and not everybody can exercise in the same way. Some people have a lot of physical limitations, and their exercise will be different and will be limited, but is still possible. Of course, there are numerous food changes to make, not only in what you're eating and the amount in which you're eating, the timing of your eating, but also chewing slowly and sipping your water more slowly and not drinking with meals. And there's a lot of those kinds of things. The fourth thing in the healthy lifestyle is to sleep. Sleep is a huge factor in weight and health, because when you are poorly rested, chronically poorly rested, you are pouring out cortisol and other kinds of stress hormones, and this prompts the body to sort of store fat and can inhibit you from losing weight, or in fact create weight gain. So that area, learning how to rest appropriately, is one of those things that people may need to change depending on where they're at. The next part of a healthy lifestyle is having love, connection, and community. And so we've touched on this a couple of times already. You need connections with other patients. You absolutely need somebody in your home that loves and supports you. And even if they don't understand all of this, they want to, and they want to help you. And then the other person that you have to have a really good relationship with, we've also touched on, which is yourself. That whole sort of learning to love yourself and put yourself first and care for yourself as well as you care for the others you love in your life. This is a huge theme for many people. And finally, the stress management. So these are the areas of a healthy lifestyle. So we're sort of expecting and promoting and empowering people to change in all of those areas throughout the 4 months. And then they have their surgery, and then there's just a whole boatload of other changes that are going to automatically need to happen.
And I think, overall for most people, they can relate to, the the fear of change is normal. It's absolutely normal. I
Yeah.
think it's an experience almost every person has, whether you're
Absolutely.
starting a new job or,
Absolutely.
you know, you're going through
Yeah.
a big surgery.
Yeah.
I think it's a very relatable.
I often say to patients in the little pre-op workshop classes that we do that they're amazing for showing up and doing this brave, amazing, life-changing thing that is so exciting, but also so stressful, and is more change that people will make in a 4 to 6 to 12 to 2-year period than many of us will make in a decade.
Right.
And to change at that quick pace is no small thing.
Right,
Yeah.
right. And it's, you know, it doesn't hurt to reinforce it. You know, people should, when going into the program, should understand a lifestyle change is,
Yeah.
it's not just a suggestion, it's
Yeah.
it's what you have to do to commit to the success of the program.
It truly is. It truly is. Without making the lifestyle change, not just for the year that you're trying to lose weight, if you want the surgery to be successful, you will make lifestyle changes and you will work on those forever because they'll need to be permanent.
Right.
It's hard enough to keep the weight loss off, all of it, anyway, because your body is always trying to go back the other direction. So, you know, you're trying to add as many elements as you possibly can to
Right.
give you more armor, I sometimes say, or more weapons in the battle against obesity. If we're in a battle for obesity, we make lifestyle changes. That helps us. We make food changes. That helps us. We have bariatric surgery, or we take a medication. That helps us. We have support. That helps us. We get better sleep. That helps us. It's all sort of, you know, helping you have resources to fight the battle.
Right.
So you have to employ many of them.
Right. I think that's a good opportunity to, it may have already been answered, but to do our final myth versus reality. Sean, would you like to do the honors?
Absolutely, thank you.
Awesome.
This is another true or false. After surgery and after the desired weight is lost, patients no longer need to periodically change habits post-surgery.
And we, you know, probably won't take too long, but, you know.
Yeah, if you want to take a few minutes, sorry to interrupt, Maureen,
Oh,
but
no worries.
if you want to take a few minutes to answer that question in the comments, again, it's a true or false. After surgery and after the desired weight is lost, patients no longer need to periodically change habits post-surgery. True or false?
So we'll do you have something else, Sean?
I did want to jump in only because Suzanne was discussing lifestyle and medication and quitting things like smoking, for instance, and we opened up questions for tonight's show earlier today, and in fact earlier this week. One question we received was from someone who was concerned about the interaction of any psychotropic medications with the weight loss program, or if it could interfere with any of the demands of the program. And they were wondering if you might be able to speak to that a little bit.
Absolutely. So many people who are seeking the surgery come in who are already on some kind of antidepressant, anti-anxiety, mood stabilizer medication. It is not a rule out for having the surgery by any means, so you certainly can come forward. And many people who are on those medications may eventually come off of some of them. Some people will never come off of some of them. There are some changes that sometimes need to be made post-operatively with certain medications for depression and anxiety. For example, extended release medications need to be changed to regular release medications. So if you're on, 150 milligrams of something extended release, we would say, please go back to the prescriber and get yourself 150 milligrams regular release. And that's due to some of the metabolic and physical changes of the surgery, and we want full absorption of those medications.
Great.
So yes, that's absolutely something, and we address that, in some detail with each patient depending on what medications they're on, and try to get them rolling with that. So that, and in that same vein, for folks who are seeing a therapist and or a psychiatrist, we often almost always reach out to those people. So have them sign a release of information. It allows us to get some information about the patient, but also almost just as importantly, often to give information to the provider in case they don't understand certain things about the surgery. Depression is one of those things that can actually improve after surgery. And we see that quite a lot. Anxiety may not improve, but depression often does. And
Is there a biological tie to that, or is there?
There's a number of medical issues that improve or sometimes completely go into a remission, and depression is one of those. And there's a lot of changes, right, that are in the brain, and so for some people, depending on the type of depression they have, they may always struggle with that no matter at what weight they're at. But it may improve. The severity of it may get better. For other people, depending on whether or not a lot of their depression was very much situationally based and a lot of really feeling bad about themselves and different kinds of factors that are involved in more of a situational depression, you may see some of that really just making huge changes and seeming like it goes away.
That's great. And I'm sure being able to freely move your body and get access to exercise, which is a huge release of endorphins.
And the other thing that comes into play here is hormones. So when you have this surgery, there are huge shifts in hormones. And hormones play a role in many things, including depression. So when certain parts of the body and certain hormonal shifts and different kinds of sort of neurotransmitter shift, so that allows some other things to improve as well.
Excellent.
Yeah.
All right. So shall we go to our myth versus reality? I feel like there should be some type of music.
I know. We need
myth versus reality. Yeah, exactly.
All right. I'll put that in my notes for next time.
Or you're going to have to verbally do it next time.
Oh, yeah, okay.
I'll put you on the spot.
Too, definitely. So as you might recall, the true or false statement was, after surgery and after the desired weight loss, after the desired weight is lost, patients no longer need to periodically change habits post-surgery. As Maureen mentioned, we've covered this in some detail, but Suzanne...
What'd you get for answers?
We got a lot of falses. We've got a very good class today. So
yes, they've been listening.
Star.
Yes, it is absolutely false, as I mentioned. There's no way to keep off all this, the weight that people lose if they're not going to make the lifestyle changes forever. And that doesn't mean no one's going to be perfect at this. Everybody is going to make mistakes. Mm-hmm. As I mentioned, that's it's expected, it's okay, but you try not to fall off the wagon and then stay off, right? You try to rally and you know that this is going to be a lifetime thing. And so, make your mistakes. It's okay. And then you'll learn and you keep going. But I think that's one of the things we really try to put out there, that this is not, patients often call this a tool. Bariatric surgery is a tool.
Right.
So only once you know what to do with the tool, you've learned about it, and you've read the instruction manual on the tool, and then you figured out how to really use the tool because you've been practicing with it for a long time. Mm-hmm. Now you're in good shape to keep on using it. But if you stop using it, it doesn't give you the benefits you'd like.
Great. Sean, how are we doing over there on the Facebook feed?
We're doing great, and thanks again everyone for watching and taking part. As often as you are, we really appreciate it.
Yeah.
And in case you're just joining us, this is Suzanne Gokabi. She is a behavioral health practitioner at Southcoast Health, and she's a licensed counselor and social worker. And she is about the best expert we could possibly have to talk about the mental side of the weight loss journey. And so we've gotten a lot of great questions tonight. If you have any questions, there's still time, still a couple of minutes to submit them. And we've got one from Krista who asks, are there age limits for weight loss surgery, like over 18 or under 90, for example?
18 and up is the answer on the lower end, and it's somewhere around 70, but there are exceptions to that, and we have had some patients who are north of 70. So I think that's usually determined between the patient and the physician. as they come forward. And I have to say, I'm here sitting here. I have two colleagues who do the exact same job as me, Maria Cruz and Rachel McGee, and they know as much as I do. We have 3 locations. We have a small offsite in Hyannis, we have the main office in Wareham, and we have Fall River. So between the 3 of us, we cover all of those locations.
Marie and Rachel.
Maria and Rachel.
Please accept my sincere apologies.
Way to go, Sean.
You 3 form
Yeah.
the best possible triumvirate of
Yeah.
expertise
Yeah.
when it comes to
Yeah.
the weight loss journey.
Yes.
Yeah,
We're the only game in town.
yeah,
That's right.
it's a great team. It's a great program. Everyone who's part of the program, I think, really exudes a commitment to not only their patients but each other. I mean, it really is an example of an incredible team, and I'm so happy you came on, and I'm grateful to your colleagues for doing the same
Yeah.
line of work.
Absolutely.
So we've got about 5 minutes left, so I want to just kind of give another summary of the lifestyle workshops, what's covered, and then we'll do maybe a takeaway and a couple more questions if people have them.
Sure. Okay.
So just kind of give me an idea. So the lifestyle workshops, just kind of give an eye about, just kind of give me
about what that is.
Yeah.
So that is, as you get closer, probably a month prior to your surgery, so now you've been in the program for about 3 months, you'll have these small group lifestyle education classes. They're 2 hours each per week, and there are 3 weeks in a row, so 6 hours total, usually in small groups of 7 to 9 patients, where we talk about emotional eating. We talk about coping skills. We really have you work hard at making those final lifestyle changes that you haven't made, because we're trying to get you ready for surgery. We have you take a look at your old habits, and can you look through the journey, sort of walk back through the journey that got you to this place, come up with anything that you think you can do to change in order to go more successfully forward. And I think one of the nice things that really happens is the fact that this is done in a small group, and people are sometimes friends with people after 6 hours, and they walk in as strangers, and they're often sitting there hardly talking to each other, and they often leave, and they're sharing phone numbers and Facebook ways to keep in touch with each other. So again, it's trying to foster, we want that social aspect. You may not come back and see us after a few years, but you might have made a friend that you'll be in touch with forever. And so that's a really positive thing.
And they'll always have that support.
Absolutely. And speaking of the support groups, once again, we have a very specific question here under the wire from Cheryl, who says, when is the next group meeting at the White Building? And anticipating that might be putting you on the spot a little bit, I looked that up.
I know the answer.
Oh, you do?
You got it.
No, please.
Yes. So the support groups in New Bedford have been newly reinstated because they were gone for a couple of years. March, April, and May, they are the first Tuesday in the month. Starting the first week of June, they will be the first Wednesday of the month. And that should be an ongoing thing. We also have, just to fill in the other groups, for those of you who are not sure, or patients that haven't received the flyer, the support groups in Wareham continue to be the fourth Tuesday. In Charlton Hospital, they continue to be the fourth Thursday. And out on the Cape, it's the first Wednesday of the month.
Wow. We don't even need a website.
We don't need a website.
That was
we have
impressive.
you here.
Yeah.
It's great.
That's great.
So we have maybe 1 minute to kind of get this one thought in, but what is the takeaway you want people to anybody watching to take away from tonight? What is your main objective?
If you're struggling with the disease of obesity and you're ready to take a serious step in the direction, whether or not you have surgery or come from weight loss, start thinking about yourself. Put yourself first. Think about what you need to do. If part of that involves coming forward into the program and having us help you, know that this is something that won't be easy, but with hard work and effort, it's possible, and you can make unbelievable changes to your life. It's the best gift that the surgery program gives us all, which is seeing ongoing support changes in people's lives all the time. So if you're ready, or if this has planted a seed, maybe you won't be ready for a year, but think about it, look into it, think about what you can do to take care of yourself.
Great. Thank you so much,
You're
Suzanne.
welcome.
Thank you for being here tonight.
Thanks.
And thank you, everybody, for tuning in. I hope you enjoyed it as much as I did. I always learn something when I talk to Suzanne. If you have more questions or are interested in signing up for one of our informational seminars, you can visit southcoast.org/weight loss. Please tune in next week for the second part of our series on South Coast Health Weight Loss Center. We'll be taking a deeper dive into the nutritional education portion of the program with Stacy Medeiros, who is a registered dietitian with the program. And we will even have a surprise guest co-host. No offense, Sean. I'm just kidding. You're still going to be on the show. You're not off the hook. But we will have a surprise guest co-host, so you don't want to miss that. And I'll have Sean sign us off for the evening.
Thanks, everyone, very much. If you had questions that we didn't get to tonight, please message us and follow us at our Facebook page for South Coast Health. Thanks a lot.